Thank you for the introduction. I've been at Oxford for about 20 years now and trying to amuse myself, generally successfully. And I've made a number of discoveries there. As was mentioned, I've done about 106 scientific papers now, and there's lots more in the pipeline. I hope you enjoyed this lecture. I doubt if any of you will forget it, unless you develop Alzheimer's disease. Can you all hear me? Okay, right. So I'm going to talk about using simple methods to understand human disease, particularly Alzheimer's disease. Those of you who do not have my deplorable lifestyle may well live to 85, and you have a 25% chance of being demented then. There will only be Alzheimer's disease. There are other types of dementia, of course, especially multi-infarct dementia from multiple blood vessel lesions in the brain. But Alzheimer's, discovered by Alois Alzheimer in 1906, is the most prevalent disease causing dementia. It is characterized by two major histopathological features: plaques and tangles. Plaques are starch-like deposits, blobby bits within the brain between the neurons, and those contain beta-amyloid complexes in the form of fibrils. Fibrils are multiple assemblies of beta-amyloid, but these probably represent the end stage of the disease process. Increasingly nowadays, people think that Alzheimer's toxicity is caused by small oligomers, much smaller, maybe 2 to 6 units long of beta-amyloid. The other histopathological feature that Alzheimer discovered was neurofibrillary tangles, i.e. the tau protein, which forms part of the microtubules conveying chemicals from one end of the nerve cell to the other. These are normally straight, but they become tangled up in Alzheimer's disease. Naturally, the nerves don't work well after that. And the main region of the brain affected in Alzheimer's, and the one which causes most of the clinical symptoms, especially in the early stages, is the hippocampus, which is Greek for the seahorse. This was taken, I'll tell you when, at the village of Mamapuram, which is some 100 kilometers south of Madras. In my younger days, I did a lot of solo cycle trips in India. I've probably ridden about 20,000 kilometers solo in different Asian countries. And that was highly educational because I learned to be adaptable, to be able to interact with people from other cultures, and being alone on a bicycle, you are exposed to situations that you will never get if you're part of a tourist group on a bus. So this general attitude has enabled me to flexibly work in science. So, here is the hippocampus, which lies in the medial temporal lobes, just inside here. Professor David Smith at pharmacology at Oxford, who was among his supervisor, by imaging techniques demonstrated that the rate of shrinkage of the hippocampus correlated with the clinical severity of the disease. So, This seems a strange title, but Oxford Dons are eccentric people, and I am no exception. I'm probably an extreme example. So, as I was explaining to the Vice Dean this morning, the left side of my brain, with the language centre, Wernicke's and Broca's area, is logical, precise and ordered. But the right side generates ideas and emotions which can, in my case, sometimes be a little crazy, but they get processed by this side, and the net result is innovation. There is one message I want you to take home from this lecture, is that you don't do science, good science, innovative science, just by reading. You must think. Descartes, the French philosopher, once said, "Cognito ergo sum," which means, I think, therefore I am. However, an extremely renowned American psychologist wrote a book called Descartes' Error. He said, it is not just thinking that makes a person. It is feeling, emotion, right-hand brain. And his name was Antonio Damasio. Descartes' Error. So I tried to get the two sides of my brain working together. And you put two things together, and sometimes you get more than the sum of the parts. The whole is greater than the sum of the parts. That is the value of multidisciplinary research. Different research groups, often international, coming together and synergizing. I have never made a grant application in my life. Luckily, I collaborated with Professor Nick Lawrence, who is now Pro-Vice Chancellor of Oxford University, and I left him to do the job for getting the money. The way I survive is to provide expertise to other groups. So, my colleague Jonathan Corcoran in King's College London, he has a grant to study methanoic acid derivatives as possible treatment for Alzheimer's. I go down and advise them. I collaborate with May Tasabaji in Manchester on Williams syndrome, a peculiar disorder in which children have an incredibly strong social bond to adults. They will start talking to any adult stranger, and a whole load of other things as well. So, May gets the grant, I set up a behavioural lab. I make bits of apparatus for her. For example, like this T-Maze here, which has been made in this department. It has sliding doors to control access to different parts of the maze. It's very simply made, but it is an extremely potent device for measuring short-term working memory in a mouse or a rat. Short-term working memory is the most prominent impairment in Alzheimer's disease. Everyone knows that Alzheimer's patients have problems with memory. So this may be the key to Alzheimer's disease. However, there is another aspect of Alzheimer's which is frequently overlooked, but the patients and the clinicians know that it is vital because activities of daily living are impaired in Alzheimer's disease. So the patient is no longer able to look after him or herself. I really should say herself or himself, since Alzheimer's is more prominent in females. Age is the greatest single factor in producing Alzheimer's disease. Females live longer than males at the present moment in the world. Therefore, Alzheimer's should be of particular concern to women. So, this illustrates the human hippocampus. This area down here, which is limpid. And when cut through at a certain angle, it looks a bit like a seahorse. Here it just appears to be a blob, and if you dissect the hippocampus as a mouse or rat, as we did the other day with our students, you simply get a tongue-shaped piece of tissue. But you cut it at a certain angle, and it looks just like a seahorse. So this is a coronal section to a human brain. Here's the hippocampus on the middle temporal lobe, and it receives connections from all over the temporal lobe in particular, and also it's the central processing unit for many other cortical areas, which of course are themselves interconnected. So the hippocampus doesn't deal in primary stimuli, like, for example, the visual cortex, in which a cell only responds to a horizontal line. Other cells only respond to a line at that angle. The hippocampus is a crossroads of all different brain areas, so it's vital to integrating their function. But it is also, because it's so highly excitable, in order to be able to record memories, it needs to be very plastic. It is liable to be a focus for epileptic seizures. And in 1953, a young man was suffering so bad seizures that the clinicians thought he's going to die if we don't do something about this. So they located the source of the seizures to his hippocampus. And they removed it. The operation was very successful in treating his seizures, but there was a terrible side effect. He lost his memory. After the operation, he was never able to consciously remember something for more than 5 minutes. So, if he left this lecture theatre now and came back just as I was finishing, he would not know what I had said, he wouldn't even recognise me. And other conditions such as hypoxia particularly destroy the cells in the hippocampus because they're so energy intensive, they're working so hard to record memories. Hypoxia, resulting perhaps from a cardiac arrest, will cause loss of memory. Also, simply encephalitis, and a really bad case of encephalitis that I saw only had a memory span of about 7 seconds. So these poor people are locked into a tiny window of time. They have no history. They can imagine the future, but what is life but just a moving, tiny window? So the rodent hippocampus is a tongue-shaped piece of tissue. It's a very large in proportion to the rest of the brain compared to the human. That's simply because of the growth of the cortex in the human. soon as the terrible effects of HM's operation became known, everyone started doing animal work to look at the effects of lesions of the hippocampus on learning and memory in animals. However, psychology was not well advanced in those early days, and very often they found the lesions have no effect on learning and memory whatsoever. The lesions were also extremely crude, often made by simply sucking out, aspirating tissue. This is an example of an early rat lesion. See these massive holes in the cortex, which have been made to aspirate the underlying hippocampus. Not a very good controlled scientific approach. This is slightly better work done by my colleague Professor Rawlins. It took him about 10 years to learn the technique, and you can see, although he's made a hole in the cortex, he has aspirated the hippocampus rather effectively, but there is still a bit of tissue left, like here, and there. And of course he has to have a neocortical lesion control group, which is this. So these are normal animals, but with holes in the cortex. This is the hippocampus itself. It is very clearly defined with these pyramidal cell lines. Dorsal hippocampus, ventral hippocampus. And in one experiment, I selectively removed not only the dorsal hippocampus, but also the ventral hippocampus. To do this, I use what's called a stereotaxic technique. This lecture is billed as being simple, cheap science, but in order to do brain surgery precisely, you do need one of these. This is called a stereotaxic apparatus. The mouse, or rat, is held between the ear bars, like that. Its nose is clamped, and so the head is fixed in a set position. This microinjector, a modified gas chromatography syringe, has an extremely fine needle at the tip, which does minimal damage to the cortex. So you don't get these horrible holes like I showed on the previous slide. And you can deliver minute amounts of neurotoxin to precisely localized parts of the hippocampus or anywhere else in the brain. So I could selectively take the hippocampus out of a mouse without doing any damage to other structures. So the head is held fixed, and the microsyringe is positioned by means of these screw drives. This moves it laterally, this moves it anterior posterior, and this moves it vertically. This is my first attempt at stereotactic lesions in the mouse. Here is a controlled mouse with its hippocampus intact. And this is a mouse which I did surgery on. Nothing but a hole. This tissue is still intact, even after several months of behavioural experiments. But you'll see it's very dark. That means the cells have died. They are gliotic. That picture earned me a trip to Russia to demonstrate the technique at an international summer school. And subsequently, I've been to Russia about 6 or 7 times. There's a biological research station near Moscow where I operate on wild pork moles, which are like little mice that live on grass in the fields. And they're the favourite food of the owl. Woo! 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 You know owl? A bird. So, as I said, you can make these apparatus such as this G-maze anywhere if you have a new colour. When I went to Nairobi to teach in Christmas 2009, I taught the guy who invited me a bit of carpentry, and this is the tea maze that we made together in his backyard. Right, the hippocampus affects memory, especially spatial memory, navigation. That is why little old ladies with Alzheimer's disease get lost in shopping malls. Shopkeepers object to having rats in their shopping malls, therefore we have to have experimental apparatus which replicates aspects of spatial stimuli. This is the classic Morris water maze, a tank full of water in which the rat or mouse has to swim to find this platform to escape onto. It is submerged just below the surface of the water, and the animal escapes onto it and doesn't have to swim anymore. That's fine for rats because they often live in sewers. They've even been known to dive in rivers to get shellfish from the bottom. And hippocampal lesions impair learning. So a normal animal will have a path after having learned the maze, which goes straight to the platform. A control lesion with just the cortex affected also goes straight to the platform. But the hippocampal lesion animal can't find its way there and swims all over the place till it finally finds the platform. But mice don't like water. They hate swimming. They are dry desert animals. Be nice to mice. That is my motto. So I made a paddling pool for the mice, in which their bodies don't get wet, but the water is just sufficiently deep to motivate them to escape. By paddling, the water only wets up the legs, and they soon dry off on the sawdust in their own cage. The mouse, being a very small animal, must conserve its body heat. It's very vulnerable to hypothermia, and therefore you must dry the mouse off carefully with a towel if it's been swimming in the Morris water maze. With my technique, there's no need for that. So my paddling pool is a white board, circular, white to motivate the animal to escape, because the mouse is a nocturnal animal and likes dark places, especially dark tunnels that look like a mouse hole. All the other exits are false. They're blocked by black painted wood. So the animal is put in the centre of the pool, unlike the Morris water maze where it's put at the side. An animal's natural instinct is to swim to the side of the water, not into the centre of the pool, because animals that fell into water, rivers, lakes in the past, did not live to have happy families. And the mouse escapes into the tube. So, hippocampal lesions work very well in the paddling pool, they impair performance. But the hippocampus isn't just about memory and spatial memory, it is also about emotion. HM is notoriously laid back. Life just passes him by. He gets a bit sad at times because he can't remember things. Eventually, his father died, and they told him this, and of course he forgot. So every time he's told your father's died, even though he's heard it 100 times before, he still gets sad, so they stop telling him. Anxiety is a particular emotion that is mediated by the hippocampus. A rat offered a novel food, such as sweetened condensed milk, which it really loves. But if it's never tasted it before, it might be poisonous, it thinks. Especially if it's in a high place on a wobbly table. So, hippocampal lesions impair spatial learning and memory, and they also produce a less anxious animal. Now I'll describe a few of the activities of baby living for which I've devised tests in the mice. Mice like to hoard food back to their nest or burrow. This is a hoarding apparatus. This is like a home cage. Here is the food, and the mice retrieve the food back to the home cage. And you simply count the number of food pellets, weigh them, that the mouse is hoarding. So I was asked by Nick to devise a mouse hoarding paradigm, but at that time I didn't realise the value of wire netting to hold the mice to stop them escaping. And one day during a walk in the countryside, I had an idea. Why not put the food source inside the home cage and see if they'll hoard from it and stash the food in the corner? And so I got a half-pint beer glass, filled it with food pellets, and put it in a mouse's cage. And indeed, they did empty the glass of the food pellets, but they didn't take the food away and stash it elsewhere. It was simply piled at the entrance to the glass. So, next slide. So, after various experiments with beer cans, etc., I found that the best container for the food was a plastic tube like this. And this mouse has been busy emptying the tube of food pellets. But you don't need, this apparatus is just so cheap and easy to make, but you don't even need that. You can just use whatever's to hand. Would you like a Pringle? They are very nice. Yes, they are. Pringles, sir? So, after you've finished eating your Pringles, you take your empty Pringles tube, you fill it with food pellets, or else sand, anything. And you put the tube, having weighed the contents, so 600 grams, plus or minus 1 gram. Put this into the mouse's home cage. You put the mouse in. This is Julie, named after the girl who gave it to me as a mascot, because I was going on a cycling trip to Pakistan to cycle over the Himalaya to China, and it was about 2 months after Salman Rushdie had published the Satanic Verses. So this was quite a wild road that I was going to cycle up, only opened to foreigners 1 year before. So she thought I needed a mascot to make sure I was safe. So Julie rode with me over the Himalaya in Karakoram, and now she's a very useful demonstrator to audiences throughout the world. So you put Julie in, and Julie will spontaneously lower all the sound out of that tube. So this is a mouse with scraping disease. The normal index of scraping is clinical signs 22 weeks after injection. So Nick Bullings and I had a kind of competition to see who could detect scraping earliest. I used the burrow tube, which costs about £1 English, 10 Egyptian pounds to make. He spent £10,000 on computer-controlled apparatus. I won by 2 weeks. I detected scraping at 10 or 12 weeks after injection. And you can see that the mice spontaneously do this, so there's no need to train them. And also, they really enjoy it. It's fun for the mice. So it's good for the scientist, and it's good for the mouse. It's a win-win situation. I'm using clay balls, which are used to line the tops of indoor plant pots to make them look pretty, because this mouse is hungry to work in the computer-controlled apparatus. He has to be food deprived. So, one advantage of burrowing is that you don't need to food deprive the animal and put it into an unphysiological state, which could potentially interact with your treatment. Back to slide. Next slide. As you can see, the scraping animals at first, 7 weeks after injection, are normal. The burrowing with practice gets better, so they burrow more food, but the scraping starts to bite around 10 to 12 weeks and dramatically inhibits burrowing. That's 2 standard errors of the mean. If these bars differ by this amount, that is significant. As you can see, it's highly significant. And this is another experiment with the error bars on. You can see that all these are highly significant. So I started looking at other species' typical behaviours, activities that they do on the mouse. One of my students said to me, "Oh, the mice in that cage, they never walk round the edge like normal mice do." I said, "You have made an observation. You didn't know which mice were which because he was blind, so as not to influence his interpretation of the behaviour." I said, "You've made an observation, now do it scientifically, quantitatively." So he counted the number of mice that were walking around the cage lid at set 1-minute intervals. And the hippocampal lesion greatly inhibit cage edge walking. It's a form of exploration, and hippocampal lesions reduce exploration. Nesting behaviour. You can give a mouse one of these little pressed pads of cotton, which is called a nestler, commercially available and therefore standardisable. Anyone in the world can follow your protocol. This is taken from my Nature Protocols nestings paper. So I anaesthetised the mice so that I could place them in relation to the nest, because mice are very active. It's difficult to get good photographs of the nest and the mouse. So, This is a better attempt at making a nest. Nesting is carried out overnight. You just put the mouse in the cage with the nestlet and assess the quality of the nest on a 1 to 5 score, the X-ray. Those scores are clearly defined in my protocol. This is a number 2 nest. A number 3 nest is scattered all over the place, and there are bits of nest that are still intact. Number 4 nest, every bit is shredded, but not gathered into a crater. It's insulating the mouse from heat loss to some extent, but not perfectly. This is a perfect nest. It's covering the mouse is keeping warm, therefore it doesn't need so much food, therefore it doesn't have to go out of its burrow to find extra food and risk being eaten by an arm. And this is scrapie again. As the scrapie starts to bite, you can see the nest scores drop dramatically. And that's the last slide. There's other tests I've devised, which I haven't got time to tell you about. For example, I can measure the strength of a mouse. Mice have a very high power to weight ratio. People think of them as puny, weak creatures. But the mouse is mighty, which is called musculus in Latin, and not without reason. So they are strong. They're also very good at coordination, balancing, so you can assess if the disease that you are studying has affected the coordination. Put it on the end of a rod and it will turn around and automatically walk back. Now let's see how the mouse has been going. What we might find is this. Then we weigh the amount of sand left here, and we can quantitate the burrow. As you can see, the apparatus is simple, the procedure is simple, it's cheap. Here in Egypt, you don't have to make proper burrows, but you must be a Pringles addict. And there's all the sand in the Western Desert. Fill your empty Pringles tubes. But to make proper lesions, you do need one of these. It's also useful to have an operating microscope, but they are very heavy and large. And if I want to do lesions in Russia, I don't want to pay £1,000 excess baggage charges to British Airways. So I have a little lens to magnify, clip it onto my glasses, and I can operate the stereotaxic machine precisely. This is a stereotaxic atlas where I can look up any brain structure, measure from the atlas what I should put on my stereotaxic, how I should adjust my machine, and then I can make my lesion. To motivate the animals to learn a maze, I can use sweet condensed milk or sweet corn. If you want to win mice and influence them, that is the key to the mouse art. So, activities of daily living. If those deteriorate, then the Alzheimer's patient needs someone to care for them. And, of course, that imposes enormous socio-economic costs. So Alzheimer's is never a disease of just one person. It's always involves other people. Now, although memory loss is a key feature of Alzheimer's, no one really worries whether Auntie Maud forgot what she had for supper last night. If you don't have a nestler, you can improvise. Fold it up in the mouse cage, and the mouse will rip it to pieces and make a lovely little nest with it. Unless it's had a hippocampal lesion, in which case, next morning, when you assess the quality of the nest, you may have to go and give it the lowest mark, 1, and the mouse may be just sitting on the nester, like it's sitting like a cat on a doormat. Okay, so you don't worry about Auntie Maud forgetting what she had for supper last night. What really worried people was the fact that she almost killed herself. What happened was, she was trying to make supper, and she was having problems. And she wanted some other things. She couldn't find them, because she'd forgotten where she put them. So she thought, oh, I'll have some crisps instead. So she put the crisps into the cake. And then she noticed that she wanted to take her shoes off, and she couldn't undo the knot. And she got really annoyed at this, and she tried to undo the shoelaces, and she hurt her foot with the knife. And eventually she got her shoe off, we may be able to help Auntie Maud by understanding how the hippocampus works. Thank you very much.